The anatomy of external ear. External ear consists of pinna and external auditory meatus. It is made up of fibroelastic cartilage covered by skin and connected to the surrounding part by ligament and muscles. It is developed from the first and second branchial arch that is called helicophysis between 6 to 28 week. Various landmarks on the pinna are helix, antihelix, lobule, tragus, concha, scaphoid fossa, and triangular fossa. You can see in this picture. Pinna has two surfaces, medial and lateral surface. The Simba conchi lies between the crus helix and crus antihelix. It is an important landmark for mustard antrum surgery. And you can see the bat is the most common congenital anomaly of the pinna in which antihelix has not developed and excessive conchal cartilage is present. The correction of pinna mostly done at 6 years of age, that is called otoplasty. In bat ear, Simba conchi is large and prominent ear like bat with antihelix is underdeveloped. There are both extrinsic and intrinsic muscles of the pinna. Extrinsic muscle are anterior, posterior, and superior auricularis. Intrinsic muscle are helicis major, helicis minor, tragicus, or antitragicus. So there are three extrinsic muscle and four intrinsic muscle. Both group are supplied by the branches of facial nerve. The sensory supply of the pinna. Now talk about first lateral surface. Upper two-thirds of lateral surface is supplied by auriculotemporal nerve, which is branch of the fifth nerve, and lower one-third by the greater auricular nerve, which is originated from the C2 and C3. Medial surface of pinna is supplied by lower two-thirds by the greater auricular nerve and upper one-third by the lesser occipital nerve. There are two nerves which supply the cavum conchi, part of external auditory canal between pinna and EAC, that Arnold's nerve. It is a branch of vagus nerve, and this branch of vagus is also called Elderman's nerve. And same part of this facial concha is also supplied by facial nerve in some area of the this cavum conchi. The blood supply of the pinna. Posterior auricular branch of external carotid artery, superficial temporal artery, a branch of external carotid artery, occipital artery, same branch of external auditory artery, and vein corresponding to the arteries drain into external jugular and common facial vein. Lymphatic drainage, they are drain into parotid group, upper deep cervical, preauricular, and post-auricular lymph nodes. Now talk about external auditory canal. Develop from the dorsal end of first branchial arch between 6 to 28 week. At birth, only cartilaginous meatus is present because the bony part develops from tympanic rim, which is an incomplete form at the time. Bony part of meatus is absent in newborn. In adult, its length is about 24 mm, outer one third being cartilaginous and inner two third 16 mm being bony. The canal form a mild S-shaped curve directly medially upwards and forward, and then medially backward and downward. So you have to manipulate ear according to the age, young or adult, in particular direction to see the tympanic membrane. The canal has two constriction of in one near the medial end of cartilaginous part and another being 5 mm short of tympanic membrane in the osseous part called isthmus. Floor and anterior wall of meatus are longer than the roof and posterior part due to oblique position of tympanic membrane. Anterior and inferior walls are formed by the tympanic part of temporal bone. Roof and part of the posterior wall is formed by the squamous part of the temporal bone. So it is formed by tympanic and squamous part of the temporal bone. So there is one is foramen of Luske. It is a deficiency in the anteroinferior part of the bony meatus. Close to it closes around 4 years of age. Another is fissures of Santorini, a deficiency seen in cartilaginous part of the EAC through which the infection of mustard and parotid gland can spread. The important relationship of EAC are condylate process of mandible is close relation to the anterior wall. Middle cranial fossa lies above the osseous meatus and mustard ear cell are posterior to it. And below you can see styloid complex. So these are the important relationship of external auditory canal. The nerve supply of external auditory canal. Anterior and superior walls come through the auriculotemporal branch of mandibular nerve. Posterior and inferior walls are supplied by auricular branch of vagus, that is Arnold's nerve, and a sensory branch of facial nerve. Nerve of Wristwork may supply a part of the posterior wall of the meatus. Then this is the nerve supply of external auditory canal. So this is all about external ear. Thank you so much. The frequency of hearing of human ear is about 20 to 20,000 hertz, but best frequency for external ear is about 30 to 3000 hertz. So best frequency at which the external auditory canal is resonate is about 2000 hertz. So external ear and pinna act as a collection of sounds. So this is the role of the pinna and external ear for the hearing.